Good morning, everyone, and welcome to our first session in the BSc Nursing program. Today, we are going to start with an important topic from the KUHS syllabus, applied anatomy. Specifically, we'll be focusing on the muscular system. Over the course of this presentation, I'll guide you through the fundamental concepts, structure, and functions of the muscles in the human body. So, let's get started and explore this fascinating system together. Today, we're going to explore the different types and structures of muscles in the human body. Understanding these basics helps us see how muscles work together to support movement and function. We'll look at the major muscle groups that are most relevant for nursing practice, so you can recognize them during procedures and patient care. Finally, we'll identify the principal muscles involved in common nursing procedures, which is essential for ensuring safe and effective care. As we go through this, keep in mind that a solid grasp of muscle anatomy enhances your ability to assess, assist, and educate patients about their mobility and health. So, let's dive into the fascinating world of muscles and see how they play a vital role in your daily nursing responsibilities. Let's take a closer look at the different types of muscles. First, we have skeletal muscle, which is voluntary, meaning we control it consciously. It's also striated with that characteristic banded appearance, and it attaches to our bones, enabling us to move our body. Next, there's smooth muscle, which is involuntary, so it works automatically without us thinking about it. It's non-striated and is found lining the walls of our organs, like the stomach and blood vessels, helping them function smoothly. Lastly, we have cardiac muscle, which is also involuntary and striated, but uniquely found only in the heart. Its structure allows the heart to contract rhythmically and effectively, keeping blood flowing throughout our body. Understanding these muscle types is fundamental because it ties into how our body performs both voluntary movements and essential involuntary functions seamlessly. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the structure of skeletal muscle. At the core, we have the muscle fiber itself, which is the basic building block of muscle tissue. Inside each muscle fiber, you'll find myofibrils, which are the tiny, rod-like structures responsible for contraction. These myofibrils are made up of repeating units called sarcomeres, and these are where the real action happens. Sarcomeres contain the actin and myosin proteins that slide past each other to produce muscle movement. Surrounding these muscle fibers are layers of connective tissue that provide support and structure. The outermost layer is the epimysium, which encases the entire muscle. Inside, we have the perimysium, which surrounds bundles of fibers called fascicles. Within each fascicle, the endomysium wraps around individual muscle fibers. These connective tissue layers not only hold everything in place, but also facilitate the transmission of force during contraction, linking the muscle to tendons and bones. Understanding this layered structure helps us see how intricate and well-organized skeletal muscle is, enabling it to perform powerful and precise movements. It also highlights the importance of each component working together seamlessly within the overall muscle function. Let's take a closer look at this skeletal muscle diagram. Here, you can see the detailed structure of a typical skeletal muscle. The main components include the muscle fibers, which are the actual cells responsible for contraction. These fibers are bundled together in groups called fascicles, which are surrounded by connective tissue layers. The outermost layer, the epimysium, encases the entire muscle. Within each muscle fiber, there are smaller structures like the myofibrils, which contain the contractile proteins actin and myosin. These proteins slide past each other during muscle contraction, which is the fundamental process that enables movement. Recognizing how these parts fit together helps us understand how skeletal muscles generate force and perform work. This diagram ties into our overall theme of understanding muscle function, highlighting how anatomy directly influences how muscles operate in our bodies. Let's take a closer look at the muscles of the body, starting with the head and neck. These muscles are crucial for functions like facial expression, mastication, and head movement. Moving down, we have the muscles of the thorax, which play a vital role in respiration and movements of the chest. Then, the muscles of the abdomen support posture and assist in breathing and movements like twisting and bending. Next, we come to the muscles of the pelvis, which are essential for stability, posture, and movements related to the hips and lower torso. The muscles of the upper limbs are responsible for a wide range of actions, from lifting and pulling to fine motor skills like writing and grasping. Similarly, the muscles of the lower limbs are fundamental for standing, walking, running, and maintaining balance. By understanding these muscle groups, we see how each region contributes to overall movement and stability, which ties back to the broader theme of how our muscular system supports daily functions and physical activity. Recognizing their roles helps us appreciate the complexity and efficiency of our body's muscular network. Let's take a closer look at the muscle groups of the body as shown in this diagram. You can see how the muscles are organized into different groups, each with its specific function. For example, the major muscle groups like the chest, back, arms, and legs are highlighted here. Understanding these groups is essential because they work together to facilitate movement, stability, and strength. For instance, the muscles in the arms include the biceps and triceps, which are responsible for movements like lifting and pushing. The leg muscles, such as the quadriceps and hamstrings, are key for activities like walking, running, and jumping. The back muscles support posture and help with lifting heavy objects. Recognizing these muscle groups helps us better understand how exercise impacts different parts of our body and why targeted training is important. It also ties into the overall theme of this presentation, maximizing performance and preventing injury through a balanced understanding of our muscular system. So always remember, knowing your muscle groups is the first step toward effective training and injury prevention. Let's take a closer look at some of the key muscles of the head and neck. Starting with the facial muscles, we have the frontalis, orbicularis oculi, and orbicularis oris. These muscles are essential for facial expressions and movements like raising your eyebrows, blinking, and smiling. They play a vital role in nonverbal communication and expressing emotions. Moving down to the neck, we have the sternocleidomastoid and trapezius muscles. The sternocleidomastoid is important for head movements, such as turning your head side to side or tilting it forward and backward. The trapezius, on the other hand, helps elevate the shoulders and extends the neck. These muscles are not only crucial for movement, but also contribute to posture and stability. Understanding these muscles helps us appreciate how complex and coordinated our facial and neck movements are, which ties into the overall theme of how muscles enable us to interact with our environment and express ourselves. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the respiratory muscles involved in breathing. First, we have the diaphragm, which is the primary muscle responsible for respiration. When it contracts, it moves downward, creating space in the thoracic cavity and allowing air to flow into the lungs. Next, there are the intercostal muscles, which are divided into internal and external groups. The external intercostals help elevate the ribs during inhalation, expanding the thorax, while the internal intercostals are more active during forced exhalation, assisting in depressing the ribs. In addition, there are accessory muscles that come into play especially during times of respiratory distress. These include the sternocleidomastoid and the scalene muscles. The sternocleidomastoid helps lift the sternum and clavicle, while the scalene muscles elevate the first two ribs. These muscles are not usually active during normal breathing, but become important when increased effort is needed. Understanding these muscles is essential because they work together to facilitate effective respiration, especially under different physiological conditions. They highlight how the thorax is a dynamic structure, capable of adjusting to meet the body's oxygen demands. Today, we're looking at a diagram of the thoracic muscles. These muscles play a crucial role in supporting the thorax, which is essentially the chest region. As you can see, the diagram highlights several key muscle groups, including the pectoralis major and minor, the intercostal muscles, and the serratus anterior. These muscles are essential for functions like breathing, especially during respiration, and also contribute to movements of the shoulder and arm. Understanding these muscles helps us see how the thoracic region is a dynamic area involved in both respiratory mechanics and upper limb mobility. Connecting this to our overall theme, it's clear how the integrity and function of these muscles are vital for maintaining posture, facilitating breathing, and enabling upper body movements. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the muscles of the abdomen. First, we have the rectus abdominis, which is the prominent muscle running vertically along the front of the abdomen. It's what gives us that six-pack appearance and plays a key role in flexing the lumbar spine, like when you do a crunch. Next, we have the external obliques, located on the sides and front of the abdomen. These muscles help rotate and bend the trunk sideways, and they're also involved in compressing the abdominal contents. Beneath them are the internal obliques, which lie underneath the external obliques. They assist in trunk rotation and lateral flexion as well, but they work in a slightly different direction. Lastly, we have the transversus abdominis, which is the deepest of these muscles. Think of it as a corset wrapping around your abdomen, providing core stability and supporting internal organs. Together, these muscles form a complex, interconnected system that not only enables movement, but also stabilizes the core, which is essential for overall functional strength and injury prevention. Understanding these muscles helps us appreciate how the core functions as a whole, supporting everything from basic movements to athletic performance. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a closer look at the pelvic floor muscles. The key players here are the levator ani and the coccygeus muscles. These muscles form a supportive hammock across the pelvic opening. Their main role is to support the pelvic organs, such as the bladder, uterus, and rectum. They also play a crucial part during childbirth, helping to guide the baby out and providing support for the pelvis. Additionally, these muscles are essential for maintaining continence, which means controlling when we urinate or have a bowel movement. Overall, the pelvic floor muscles are vital for both stability and function of the pelvic region, connecting directly to the themes we've discussed about pelvic health and biomechanics. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a look at some of the key muscles involved in upper limb movement. First, we have the deltoid, which is primarily responsible for shoulder abduction. That is, lifting your arm away from your body. It plays a crucial role in shoulder mobility and stability. Moving down the arm, we encounter the biceps brachii. This muscle is essential for elbow flexion, allowing us to lift or curl objects. It's also important in various daily activities that involve pulling or lifting. On the other side, we have the triceps brachii, which is responsible for elbow extension, straightening the arm out. This muscle works in opposition to the biceps and is vital for pushing movements. Finally, we have the muscles of the forearm, which include flexors and extensors of the wrist and fingers. These muscles give us fine motor control and strength for gripping, writing, and manipulating objects. Together, these muscles form a coordinated system that enables a wide range of upper limb movements, highlighting how interconnected and specialized our muscular system is for functional activities. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the muscles of the lower limb, starting with the gluteal muscles. These include the gluteus maximus, medius, and minimus, and they play a crucial role in hip movement. The gluteus maximus is the largest and most powerful, responsible for extending and outwardly rotating the hip. The medius and minimus are smaller but essential for stabilizing the pelvis during walking and other movements. Next, we have the quadriceps group. This group consists of 4 muscles: the vastus lateralis, medialis, intermedius, and the rectus femoris. Together, they are primarily responsible for extending the knee, which is vital for standing, walking, and running. Moving on to the hamstrings, which include the biceps femoris, semitendinosus, and semimembranosus. These muscles are located at the back of the thigh and are mainly involved in knee flexion and hip extension, playing a key role in movements like bending the knee and thigh movements during walking and running. Finally, we have the calf muscles, composed of the gastrocnemius and soleus. These muscles are essential for plantar flexion of the foot, enabling actions like pushing off the ground when walking, running, or jumping. Altogether, these muscle groups work in harmony to facilitate a wide range of lower limb movements, supporting mobility, stability, and strength. Understanding their functions helps us appreciate how the lower limb contributes to overall movement and activity. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a closer look at some of the principal muscles that are important in nursing practice. First, we have the deltoid muscle, which is a common site for intramuscular injections. It's easily accessible and ideal for delivering vaccines or medications. Next, the vastus lateralis muscle is especially important when administering injections to infants, as it provides a safe and effective site for IM injections in this age group. Moving on, the gluteal muscles, particularly the dorsogluteal site, are also used for IM injections, though we need to be cautious to avoid nerve damage. Additionally, the abdominal muscles play a vital role not only in injections, but also in assisting with positioning and breathing exercises, especially in patients with respiratory issues. Lastly, the respiratory muscles are a focus during therapy or when observing for signs of distress, as they are critical for effective breathing and overall respiratory function. Overall, understanding these muscles helps us deliver care safely and effectively, ensuring we target the right areas and support our patients' recovery. Now, let's talk about the importance of site selection for intramuscular injections. Choosing the correct site is crucial to ensure proper absorption and minimize discomfort or complications. Next, it's essential to position patients correctly by applying our knowledge of muscle anatomy. Proper positioning not only makes injections easier, but also reduces patient pain and tissue damage. Supporting respiratory care is another key aspect. Understanding how accessory muscles are used during breathing allows us to better assess respiratory status and provide targeted interventions. Finally, preventing pressure ulcers is vital. We can do this effectively through regular muscle movement and rotation, which promotes circulation and reduces prolonged pressure on vulnerable areas. All these points highlight how a solid understanding of muscle function and positioning directly enhances patient care across various clinical situations. The muscular system includes three main types of muscles: skeletal, smooth, and cardiac. Each of these has distinct functions and characteristics that are essential to understanding how the body moves and operates. When we talk about muscles being grouped by body region, it helps us better understand their specific roles and how they interact within different parts of the body. This regional grouping is especially important in nursing procedures, where knowing the precise anatomy of muscles can influence how we perform tasks and ensure patient safety. So, to sum up, having a clear grasp of the muscular system's structure and regional organization enhances our ability to provide effective care and understand the body's complex movements. Let's take a moment to look at the key references that underpin this course. First, we have the Textbook of Anatomy and Physiology for Nurses, which is a comprehensive resource tailored specifically for nursing students, helping us understand the fundamental concepts in a clear and practical way. Next is the KUHS Applied Anatomy Syllabus, which guides the curriculum and ensures we're covering all the essential topics relevant to our field. Lastly, we have Tortora and Derrickson's Principles of Anatomy and Physiology, a well-respected textbook that provides a solid scientific foundation and detailed explanations of the body's structure and functions. These references are crucial because they support the content we've covered and serve as reliable sources for further study. Keeping these resources in mind helps us stay grounded in accurate information and highlights the importance of thorough preparation as nurses.